I mean, simply this program requires drug makers to sell their products to hospitals at a discount. Um, Hospitals and some hospitals, some contract pharmacies resell them. They pocket the difference. So from our standpoint, it's the government picking and choosing winners, in this case, some hospitals, and losers, drug manufacturers, among private market participants, which is not an appropriate role for the government. There was some hospitals, of course, are arguing they need the money and that they use the money to help patients. That is, that they use the extra revenue to cut costs or provide free care for those in need. I think those claims are dubious, at least on the evidence that we have. There was a question earlier about, is this money required to stay in the community? And that is not a requirement of the program, and it is something that does not happen in the program. The New York Times did a good article 3 years ago about a large hospital system buying a hospital in a low-income area, using that to purchase the drugs at a discount and shipping the revenue out into their wealthier outposts. There is nothing, very little, that would prevent that from happening in this system. The New York Times called it basically laundering money. And the research we do have on this in Michigan is that, we've had this big expansion in the program, but over that time period, charity spending as a percentage of revenue has not kept up with that, and in fact has declined. And there was a study looking at the Michigan hospitals that participate in the 340B program compared to hospitals as a whole. And the hospitals that took part in the 340B program are more profitable, but spent 20% less of their revenue on charity care. So the idea that if you participate in this program, it's going to be used more as charity care, I don't think the bulk of the evidence shows that to be true. This program has massively expanded. It was $6 billion in 2010. It's $66 billion today, so tenfold increase. And during that period, hospitals have also benefited from the expansion of Medicaid across the states, including here in Michigan. I've been at the Mackinac Center for 16 years. I was here when we debated expanding the Medicaid. And the key argument at the time was Medicaid expansion is going to allow us to take care of this charity problem. Hospitals won't have to do as much charity care because they'll have this Medicaid money covering people who need the care in their hospital. And so the simple question I have is, if that was a key argument, if we expanded Medicaid to cut down on charity care, then why has this 340B program exploded so much from $6 billion to $66 billion? And the simple answer is because the revenue from 340B gets redistributed in other ways. So I don't think it's been an effective program at any of the goals that people talk about that it can be used for. And we don't think it's appropriate for lawmakers to use government power to pick these winners and losers in the marketplace. They should do other options like expanding competition for drug manufacturers and for hospitals.